Up next on The Reveal.
Encouraging all Georgians, even if they are not experiencing symptoms, to schedule an appointment.
Georgia's governor says COVID-19 tests are available for everyone. But is that the case? We see for ourselves.
I have no conditions at all, just wanted to get the test.
That's it.
That's all that. Oh, wow.
It's the first line of defense in the fight against the deadly virus.
Even if they don't personally feel ill, they can still be infected.
But does it work? And one man's amazing tale of survival.
If people aren't giving up on me, I can't give up on them.
From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal. I'm Chief Investigator Brendan Keith. 11 Alive has analyzed the data, and the numbers show that Georgia has ramped up testing after Governor Kemp urged all Georgians to get tested for the coronavirus, whether they have symptoms or not. But The Reveal has discovered access to testing remains hit or miss months into the pandemic.
Are you registered yet, sir?
What's that?
Have you registered yet?
Yes, I have a reservation number here.
My test for the COVID-19 virus is waiting in this Alpharetta parking lot, but the road to get here was paved with denials, delays, and dollars.
It's a vicious cycle. Call here, call here, call here, call here.
That was mid-March.
I'm calling to see how I could get tested for COVID-19.
When diagnostic testing still required symptoms and recent travel to a foreign country.
Anybody that wants a test can get a test.
Are they telling the truth?
Nope, that's false.
If we're not testing people with symptoms, we don't have a handle on just how serious and widespread this is?
Absolutely. I don't think the numbers that are being reported can even reflect what's really going on if everyday people can't get tested.
Governor Kemp changed all that 2 months later as the state opened more testing sites.
Encouraging all Georgians, even if they are not experiencing symptoms, to schedule an appointment.
I first went to the free CVS testing site at Georgia Tech. The website still pre-screens people based on symptoms, none of which I have. In all 3 tries over the last week, the system replied, "You do not qualify for testing at this time."
Let's take a closer look at the coronavirus. As we zoom in, there's that familiar shape. But let's go inside the virus to see what the diagnostic tests are actually looking for. It's these blue strands right here. This is RNA. These are the nucleic acids that are essentially the genetic fingerprint of the virus. That's not what the blood tests are looking for. Those are looking for the antibodies that your immune system produces to hunt down the virus in your body and destroy it.
I was able to get antibody testing at Quest Diagnostics. The blood test has no prerequisites other than you can't be sick and you must be willing to pay $129 for the retail test. But the results 24 hours later don't tell you if you're currently infected, only that you've previously been infected and now have the antibodies.
Or get a screening through the AU Health Express Care app.
So I downloaded the state's app from Augusta Health and was screened for symptoms.
No, I have no conditions at all. Just wanted to get the test since the governor had mentioned that everyone should get tested.
Yeah, that was our governor recommended. So here's the thing I want you to understand. Since you don't have symptoms, you are in a very low risk category for having complication if you get infected. CDC guidelines do not recommend you to get a test, but you insist. I can register for you. However, that comes with the cost for the COVID-19 test.
I see. How much is it?
About $300 something. That's what I heard.
$300. Okay.
The governor's office insists there is no cost for COVID testing, but the nurse practitioner on the state's app suggested it's not worth it for asymptomatic Georgians.
Practicing social distancing, washing your hands, and those kinds of things would be very, very effective, cost effective.
All right, so we're a minute and a half into the call to the Fulton County Board of Health, and it's just repeating a recording saying it's the COVID hotline.
My county health department, also recommended by the governor, booked my free test for the next day, no questions asked.
Okay, even though I don't have symptoms, I can get in there without a charge.
All right, the results are coming back in about 5 days.
Got it.
When I got to the Alpharetta testing site Saturday morning, the parking lot was nearly empty, the National Guard not letting anyone in without a reservation. I saw only one other patient.
You guys are the real heroes in this, I'll tell you.
The whole test was over in seconds.
All right, go ahead.
Only 5 seconds, okay? You can do this. 1, 2, 3, 4, 5. That's it.
That's all that. Oh, wow.
Unlike the government-backed CVS testing I didn't qualify for, which returns results in minutes, I won't know if I was positive last Saturday until days later.
You should receive a phone call within 4 to 10 business days.
Up next on The Reveal.
Even if they don't personally feel ill, they can still be infected.
Contact tracing. How does it work? And can it save lives?
This month, Georgia started ramping up contact tracing. It's the first line of defense to stop the spread of the coronavirus. It's action the state failed to take early on during the pandemic that could have prevented infections.
We're so excited. Andy? Awesome.
As Georgians continue to take advantage of takeout, the possibility of picking up the coronavirus remains. Atlanta restaurant Little Ray learned that a few weeks ago, leaving this voicemail for the public after one of its employees tested positive.
Due to a possible exposure and out of abundance of caution, we are temporarily suspending service at Little Ray.
Thank you.
The restaurant is back open after it says it immediately notified staff, who then followed CDC quarantine guidelines. Infectious disease experts say an increase in contact tracing this week will help to stop the spread. Here's how it works. After a local health department has notified someone tests positive for COVID-19, a contact tracer tracks down the infected patient. They then request contact information of the people who they were around, starting at least 2 days before exhibiting symptoms. But not everyone. Only people who are within 6 feet for 15 minutes or more at a time. Fazle Khan is the chief epidemiologist at Fulton County's Board of Health.
Even if, let's say, a person who was infected was working behind the counter or somewhere and was just casually serving people, that would not constitute a close contact. But his or her fellow staff who are working in and around them in close proximity would be close contacts. If a person is a school teacher, on the other hand, it could be 100 kids that were potentially, and then others, faculty and staff, that could have been potentially infected.
Identities of positive COVID-19 patients are kept anonymous. Those exposed are asked to self-quarantine for at least 14 days.
Contact tracing is going to be really important.
Bob Bednarchek is an assistant professor of global health and epidemiology at Emory's Rollins School of Public Health.
Even if they don't personally feel ill, they can still be infected, they can still be potentially spreading the virus.
Some Georgia counties just started using software to monitor the infected. The voluntary pilot program sends text messages to notify people who are potentially exposed. But Bednarchek says that shouldn't replace what he calls shoe leather epidemiology.
I think there is something to be said about that individual level contact, speaking to someone who can go through the detailed information about the importance of isolation, of checking your temperature regularly, of avoiding contact, keeping that physical distance from other people during that period.
Fulton County says it needs at least 70 contact tracers to keep pace with the increased testing. So far, it has about 40.
Seeing that we don't have the current staffing levels to manage this, maybe a little bit of a wake-up call for us to see that, these investments in public health.
The state hopes to hire about 1,000 contact tracers. Experts emphasize contact tracing only works when people who've been notified that they were likely exposed actually self-quarantine.
Coming up is the day he thought he might not ever see.
If people aren't giving up on me, I can't give up.
What gave him the courage to fight on?
Welcome back to The Reveal. I'm Faith Abube. A 65-year-old community activist was probably among one of the first cases of the COVID-19 virus here in the state of Georgia. He spent 19 days in the hospital, a week of that on a ventilator, unsure if he would survive. But Richard Pellegrino is now out of the hospital and sat with me exclusively for his first interview. We talked about his nightmare experience with the virus, whether the controversial lupus drug treatment helped his case, and his new appreciation for life.
Hi, Daddy. Hi.
If Richard Pellegrino could run, he would have leapt out of his wheelchair right about now to hug his children's neck.
How you doing?
So that was just, that was just great.
For 19 days, all he wished for in his hospital bed was healing, so he could see his family, walk on his own feet, and feel the sun on his face again.
And how warm it was and spring-like, and, it was a rebirth.
A rebirth that started in early March when the 65-year-old felt a mild fever, a dry cough, and couldn't catch his breath. But it took 3 trips to the ER for doctors to finally admit him. By then, the virus had spread.
When you can't breathe, when you can't catch your breath, it's the worst feeling.
Richard says his condition deteriorated so quickly, doctors at Wellstar Cobb and Austell tried any and everything.
They asked permission, and we tried this experimental treatment, the anti-malarial drug. And at that point, I would have said probably yes to anything. And I agreed. I didn't feel better, but I don't think it hurt me, let's put it that way.
2 days later, his medical team was forced to put him on a ventilator. His family couldn't visit, and since Grandpa couldn't talk, the kids got creative.
The emotional support from friends and family and colleagues and everything was the best. I would say that was equal or greater than any medicinal or physical intervention that push you and keep you going. It's real. That's what pulled me through. That's what made me want to fight. I said, I can't give up. If people aren't giving up on me, I can't give up on them.
It wasn't easy. Richard says it felt like pulling himself from a deep pit.
And that's the pit of darkness, literally, because you're not getting oxygen to your organs, to your brain. Of course, coming out of off the ventilator, I wanted to get back on it. I was gasping. I didn't know how to speak. I didn't know how to swallow. I was basically starting all over.
But who knew it would end this way?
Hi, Daddy. Hi.
The son, his kids, and his first steps outside the hospital in 19 days.
And it was just like heaven.
Thank you. Yes, sir. Thanks for everything.
Richard couldn't stop talking about how wonderful his medical team was at the hospital. He plans to start a community fundraiser for all his medical heroes. Head over to 11alive.com for details.
Hundreds of thousands of people worldwide have survived COVID-19. And for many survivors, it stays with you physically or mentally. And for some, it has given life new purpose. Matt Pearl shows us the faces of recovery.
We represent people that have a story to tell. My name is David Jameson.
My name is Amanda Trejo.
Marissa Liuzzi.
Scott Schuback.
And I am a recovered COVID-19 patient.
I was a patient in an intensive care unit.
I've just recovered.
Out of the 12, there was about 8 of us that were affected.
I'm still having issues. I'm still having issues sleeping, still having issues with anxiety.
When I walk up the stairs from the parking lot to the entrance and I'm carrying a briefcase or some papers, I have to slow down.
We've been just really trying to just stay away from everyone and only leaving the house to give plasma.
My aunt was positive for COVID-19 and was admitted to the ICU. I went and donated my plasma. Within about the next 11 days, she was able to come off the ventilator.
Everything that we can do to possibly help save a life is something that people need to start really looking into.
I truly believe that maybe I got COVID-19 so I could save not only my aunt, but a stranger as well.
This situation has taught me that we should never, ever take anything for granted.
For whatever reason I'm here, it is upon me to become a better person. As a physician, a father, a husband, that is upon me to become better.
I think this is a trying time.
We have a happy ending, fortunately for us.
It would be a waste for a person to go through something and not inspire someone else who's going through the same thing.
When the reveal returns, an innovative idea that's saving lives.
What we did is put the straps on.
An orthodontist in Cumming sparked an effort to help doctors and nurses around the world. Dr. Mark Causey says more than 1 million people have visited his website, and folks in 20 different countries have downloaded the template to make 3D printed protective face masks. But all you have to do is look at what's happening at his hometown hospital to know he's making a difference.
We have people out there with bandanas, we have scarves.
It started with an orthodontist in Cumming who wondered, how could his 3D printer make masks for medical professionals in need?
They were crying because they weren't being given the proper equipment.
From that question blossomed a community as layered and dimensional as the masks themselves. An engineering high school teacher and a visual arts professor helped Dr. Mark Causey refine the design. When the University of North Georgia donated the plastic and use of nearly 3 dozen 3D printers, there was no turning back.
We are putting masks together.
Volunteers at area churches and families sat around dinner tables to piece by piece put together the vision.
What we did is put the straps on, cut these down, put these on, and then putting the piping in.
Katie Bruner is just one of many moms working with their kids to assemble the masks.
You're so disconnected. You're watching everything and feel like you can't do anything to help. And so it gives some purpose for us.
Their destination, Northeast Georgia Health System.
Lord, we pray your blessings upon these masks.
We were there as pastors in Hall County gathered to pray.
We not only pray for these masks, but we pray for those who will use them.
As more than 750 masks were delivered.
It's very heartwarming and it's very humbling.
COO Mike Covert says the system's 4 hospitals are treating more than 120 patients with COVID-19, about a third of those on ventilators.
If it wasn't donating material, it was donating time.
Robert Turner, the hospital's business development director, was the one tasked with finding a backup mask supply. When he saw Causey's design, he jumped, creating the network that helped make them a reality.
There hasn't been one person that hasn't willingly taken on the challenge of putting these things together and help us to kind of create a solution.
Like the teacher who had the idea to use the laser cutter at the Dawson County College and Career Center to process the material purchased by the hospital for the mask filter.
We couldn't stamp it out because it was too thin. It's been tremendous help.
There's still concern about supplies, but the hospital says this has helped put some minds at ease.
It's actually been a morale booster for our staff and for our physicians.
And what about the man who wondered just weeks ago if all of this could be done?
I'm speechless, really. It shows the power of love.
Well, there was a hotspot in Gainesville earlier this month. The hospital system says, thanks to social distancing, the number of confirmed and presumed positive COVID-19 cases has hovered around 230 for the past few days. That means they have avoided the surge that they feared would come in mid-May.
Thanks for watching The Reveal, the nation's only weekly local investigative show. We'll see you next week for another episode of The Reveal.